So now we'll move on to talking about breast lifts or mastopexies. So this is done to reposition where the nipple is on the breast mound to make it higher, and it helps remove extra skin and then sometimes breast tissue as well. The limitations are it doesn't tend to give that upper pole fullness that actually a lot of people are looking for. So when they come in and think that they just need a lift, they're actually looking for the look of implants with a lift. So it's important to know the benefits of each of those procedures and where they can help. And also, just with doing a breast lift, you can actually look a little smaller afterwards because you're taking off extra skin and kind of tightening things up. So it's important to know what the final results, what you hope they are as far as the overall volume and then the overall shape of the breast as well. Now, with lifts, I do tend to be a little bit more aggressive because we're always fighting age and gravity. Um, it's my personal preference to, in most patients, use the anchor scar pattern here. It goes around the areola, down the breast, and then along the bottom because, at least in my hands, it tends to give the best shape overall because I'm removing skin in different directions to get the best shape of the breast. If you tend to do a lift that, for example, you're only going around the areola, you're only removing it in one direction, so it tends to flatten the breast. Also, if I remember to point it out in later pictures, all that tension is around the areola where you have removed extra skin. That can tend to widen the areola with time because that tissue is very stretchy. And so it's very common for me to see patients who've had that what's called a donut lift that didn't actually lift things very well or for very long. And then it just ended up kind of widening the areola. So I do like this, even though it seems very aggressive with the resulting scars. The scars, tend to fade pretty well with time. So it is a trade off, but I think you get the best shape with that.